Diabetes, macro and microvascular complications. Today we're covering the introduction, macrovascular complications, microvascular complications, and prevention. What is diabetes? Diabetes is a chronic health condition characterized by hyperglycemia, or in other words, increased blood sugar level. In the healthy population, the pancreas secretes insulin in response to sugar intake. However, people with diabetes either produce insufficient level of insulin or the body stops responding to insulin. Although diabetes may seem insignificant, this condition is in fact very dangerous. Untreated and long-lasting diabetes can lead to both microvascular and macrovascular complications. Thus, it is extremely important to prevent diabetes. Macrovascular complication. Cardiovascular event is the leading cause of mortality in patients diagnosed with diabetes. In people with diabetes, hyperinsulinemia and hyperglycemia contributes to chronic inflammation, leading to atherosclerotic changes of the arterial vessels and eventually causing occlusion of said vessels. For example, if the vessels that supply the heart are occluded and blood can no longer supply the heart, this will lead to myocardial infarction, or more commonly known as heart attack. Many research has shown the significant increase of myocardial infarction in diabetic patients and is said to be as high as people who has a history of a heart attack. One of the concerning cerebrovascular complications of diabetes is stroke, as diabetes increases the risk of ischemic stroke up to 2.3 times and hemorrhagic stroke by 1.6 times. Patients with diabetes who suffer a stroke has also shown worse outcomes, higher death rates and morbidity, and increased percentages of stroke-related dementia. As mentioned before, diabetes can lead to atherosclerotic changes of the blood vessel. If peripheral vessels are affected, the limbs supplied by these arteries will receive less blood and thus less oxygen. Chronically, these will lead to pain with use, non-healing ulcers, and eventually may lead to amputation if complications occur. Hyperglycemia can also affect small blood vessels, which result in microvascular complications, such as diabetic retinopathy, nephropathy, and neuropathy. Diabetic retinopathy is one of the most common microvascular complications of diabetes. Blood vessels of the retina are damaged from persistent high blood sugar, which allow blood to leak from the vessels into the retina and cause symptoms such as floaters, spots in vision, blurred vision, difficulty seeing in the dark, and eventually blindness if left untreated. Because diabetic retinopathy can be asymptomatic in the early stages, eye screening is recommended for everyone with diabetes who is 12 years or older, because everyone with diabetes is at risk for diabetic retinopathy. The longer you have diabetes, the more likely you are to develop diabetic retinopathy. Screening is offered because screening can detect problems in your eyes before they start to affect your vision, and if problems are caught early, treatment can help prevent or reduce vision loss. Diabetic nephropathy is a serious complication of diabetes. It is one of the leading causes of chronic kidney disease and end-stage renal disease, which leads to the requirement for dialysis or kidney transplantation. Persistent high blood sugars over a long period of time can cause damage to the blood vessels in your kidneys that filter the waste from your blood. This can lead to kidney damage and cause high blood pressure. Diabetic nephropathy commonly causes no symptoms until at least 80% of your kidney function is lost. Therefore, to detect diabetic kidney disease, healthcare providers rely on tests that measure protein levels in the urine and blood tests to evaluate the kidney function. In later stages, patient may present with worsening blood pressure control, foamy urine, and swollen feet. Diabetic neuropathy is a nerve damage that occurs as a complication of diabetes. High blood sugar can damage small blood vessels supplying nutrients to the nerves. As a result, the nerve becomes damaged due to lack of nutrients. Once the nerves are damaged, they can't be repaired. Symptoms of diabetic neuropathy depends on which nerves are affected. Diabetic neuropathy most often damages nerves in the legs and feet, can be motor or sensory neuropathy. Sensory neuropathy affects the nerves that carry messages of sensation to the brain, leading to symptoms such as tingling, numbness, burning, or shooting pain, or loss of ability to feel pain. Autonomic neuropathy affects the nerves that control functions of your organs and glands, resulting in organ dysfunction, for example, irregular heartbeat and loss of bladder control. Motor neuropathy affects the nerves that control movement, leading to problems such as muscle weakness, muscle twitching, and cramps. The American Diabetes Association recommends that screening for diabetic neuropathy begins immediately after someone is diagnosed with type 2 diabetes, or 5 years after the diagnosis of type 1 diabetes. After that, screening is recommended once a year. How do we prevent diabetes? The risk of getting diabetes can be reduced with lifestyle modification, such as diet changes, specifically diet rich in fiber and whole grains and low saturated fat. Developing a regular exercise regime has also been proven to prevent diabetes. Weight loss may be necessary in overweight and obese people. Finally, it is highly recommended to stop smoking and drinking alcohol. Thank you.